My name is Cheryl Erickson and I'm the Indigenous focused ECE instructor with Louis Riel Vocational College. Today in Child Development 1, we are looking at Chapter 4 and the birth process in the newborn baby. So you will be watching a video that goes through the stages of labor as well as caring for a newborn baby. So please do ensure that you are reading Chapter 4, as this video is not a replacement for your chapter reading.
Infants, Children, and Adolescents. 8th edition. Chapter 4. Birth and the Newborn Baby. Learning Objectives, 1 of 2. 4.1 Describe the 3 stages of childbirth, the baby's adaptation to labor and delivery, and the newborn baby's appearance. 4.2 Describe natural childbirth and home delivery, noting benefits and concerns associated with each. 4.3 List common medical interventions during childbirth, circumstances that justify their use, and any dangers associated with each. 4.4 What are the risks of oxygen deprivation, preterm birth, and low birth weight, and what factors can help infants who survive a traumatic birth? Learning Objectives, 2 of 2. 4.5 Is close parent-infant contact shortly after birth necessary for bonding? 4.6 Describe the newborn baby's reflexes and states of arousal, including sleep characteristics and ways to soothe a crying baby. 4.7 Describe the newborn baby's sensory capacities. 4.8 Why is neonatal behavioral assessment useful? 4.9 Describe typical changes in the family after the birth of a new baby, along with interventions that foster the transition to parenthood. The 3 stages of labor. Figure 4.1, the 3 stages of childbirth. Figure 4.1. The APGAR scale score sign 1-2 heart rate no heartbeat. Score. Sign. 1. 2. Heart rate. No heartbeat. Under 100 beats per minute. 100 to 140 beats per minute. Respiratory effort. No breathing for 60 seconds. Irregular, shallow breathing. Strong breathing and crying. Reflex irritability. No response. Weak reflexive response. Strong reflexive response. Muscle tone. Completely limp. Weak movements of arms and legs. Strong movements of arms and legs. Color. Blue body, arms, and legs. Body pink with blue arms and legs. Body, arms, and legs completely pink. The APGAR scale, continued. Score of 7 or better, good condition. Score between 4 and 6, baby needs assistance. Score of 3 or lower, baby is in serious danger and needs medical attention. Approaches to childbirth. Western society. Before late 1800s home births. Post-industrial revolution hospital births. 1950s 1960s movement toward natural childbirth. Today birth centers, and some home births. Elements of natural, or prepared, childbirth. Classes. Relaxation and breathing techniques. Labor coach. Other natural childbirth practices. Doula, a trained lay attendant who provides social support. Delivery positions. Upright, shortens labor and reduces complications. Water birth, relaxes mother, shortens labor, and reduces complications. Home delivery, less than 1% of U.S. births. Medical interventions in childbirth. Fetal monitoring. Medication. Analgesics. Anesthetics. Instrument delivery. induced labor, caesarean delivery, instrument delivery. Low forceps can injure the baby head and the mother's tissues. Vacuum extractors increase the risk of bleeding between baby's skin and skull, bleeding beneath the baby's skull, infant seizures. Instrument delivery. Figure 4.2, Instrument delivery. Figure 4.2. Caesarean delivery. Caesarean deliveries account for 37% of births in the United States. Caesareans are warranted in medical emergencies such as H incompatibility, premature separation of the placenta from the uterus, infection, baby in breech position. Many caesareans are unnecessarily performed. Anoxia, oxygen deprivation at birth, can lead to brain damage or later cognitive, language problems. Cerebral palsy. Causes include squeezing of umbilical cord, placenta abruptio, placenta previa, failing to breathe after birth, preventing brain cell death from anoxia. Additional brain cell death can occur in the hours after birth. Prevention strategies. Head cooling device reduces brain damage and increases newborn behavioral assessment scores. Pre-cooled water blanket reduces death and disability rates in the first 2 years. Preterm and small for date babies, born weeks before their due date, may be appropriate weight for length of pregnancy. Small for date may be born at due date or preterm, below expected weight for length of pregnancy. Rates of infant survival and disability by length of pregnancy. Figure 4.3, Rates of infant survival and child disabilities by length of pregnancy. Figure 4.3. Adapted from Bellizetti et al., 2006. Preterm infants. 1 to 2 more weeks in the womb can contribute greatly to infant health. Reduced rates of illness. Fewer costly medical procedures. Shorter hospital stays. More favorable physical and cognitive development. Interventions for preterm infants. Isolate. Respirator. Feeding tube. Intravenous medication. Special infant stimulation. Kangaroo care. Parent training in caregiving. Influence of intensity of early intervention for low-income preterm babies on intellectual functioning at age 8. Figure 4.4, Influence of intensity of early intervention for low-income preterm babies on intellectual functioning at age 8. Figure 4.4. Adapted from Hill, Brooks Gunn, and Waldfogel, 2003. Healthcare for parents and newborn babies. Infant mortality. Number of deaths in the first year of life per 1,000 live births. In spite of technological advances, the United States has made little progress in reducing infant death rates. Neonatal mortality. Number of deaths in the first month. Low birth weight is the second highest contributor to infant mortality, which is largely preventable. Infant mortality around the world. Figure 4.5, Infant mortality in 37 nations. Figure 4.5. Adapted from U.S. Census Bureau, 2014a. Birth complications, parenting, and resilience. Kauai study. If birth complications are not severe, a supportive home can restore children's growth. Some children with troubled home environments are able to overcome birth complications with outside support. Precious moments after birth. Oxytocin causes the breasts to let down milk, heightens the mother's responsiveness to baby. Fathers also show hormonal changes that are associated with positive emotional reactions to infants. But a favorable parent-infant relationship does not depend on immediate bonding. Newborn reflexes: eye blink, rooting, sucking, swimming, moropalmar grasp, tonic neck, stepping. Babinski. Adaptive value of newborn reflexes. Survival. Evoking interaction from caregivers. Motor development. Infant states of arousal. Regular, NREM, sleep. Irregular, REM, sleep. Drowsiness. Quiet alertness. Waking activity and crying. The mysterious tragedy of sudden infant death syndrome. SIDS is the leading cause of infant mortality between 1 week and 12 months in industrialized nations. Its occurrence tends to peak between 2 and 4 months of age, when reflexes decline, reducing incidence of SIDS. Quit smoking and taking drugs. Put babies to sleep on their backs. Remove soft bedding. Pacifier use. Ways to soothe a crying baby. Hold on shoulder and rock or walk. Swaddle. Pacifier. Talking or rhythmic sounds. Ride in carriage, car, swing. Massage. Combine methods. Newborn sense of touch. Reflexive response to touch on mouth, palms, soles, genitals. Sensitive to pain. Severe pain can disrupt child's developing capacity to regulate stress. Relieve pain with analgesics, sugar, breast milk, gentle holding. Newborn senses of taste and smell. Prefer sweet tastes at birth. Quickly learn to like new tastes. Display odor preferences from birth. Can locate odors and identify mother by smell from birth. Newborn senses of taste and smell. Figure 4.6, examples of facial expressions of newborns exposed to the odor of anise whose mother's diets differed in anise-flavored foods during late pregnancy. Figure 4.6. From B. Schall, L. Malia, and R. Susainen, 2000, human fetuses learn odors from their pregnant mother's diet. Chemical Senses, 25, p. 731. Reprinted by permission of Oxford University Press Incorporated, and Benoist Schall. Newborn sense of hearing. Can hear a wide variety of sounds at birth. Prefer complex sounds to pure tones. Learn sound patterns within days. Sensitive to voices, and biologically prepared to learn language. Newborn sense of vision. Least developed of senses at birth. Unable to see long distances or focus clearly. Scans environment and tries to track interesting objects. Color vision becomes adult-like after 4 months. Infant vision versus adult vision. Figure 4.7, view of the human face by the newborn and the adult. Figure 4.7. From Kelman and Arterberry 2006, Slater et al., 2010. Neonatal Behavioral Assessment. Neonatal Behavioral Assessment Scale, NBAS, evaluates a baby's reflexes, muscle tone, state changes, and responsiveness to physical and social stimuli. Neonatal Intensive Care Unit Network Neurobehavioral Scale, NNNS, is specially designed for use with newborns at risk for developmental problems. Transition to parenthood. Gender roles may become more traditional. Sharing caregiving predicts greater happiness and sensitivity to the baby. Postponing parenthood until the late 20s or 30s eases transition. Single mother families. 40% of U.S. births to single mothers. Most non-marital births are unplanned. Adolescents. Low-income women in 20s. Financially secure women ages 30 to 45 are an exception. Parental depression and child development. 8 to 10% of mothers experience chronic depression. 3 to 5% of fathers also report depression after the birth of a child. Parental depression can have serious negative effects on all domains of child development. Early treatment is vital. Interventions for new parents. Pre-birth counseling can ease the transition to parenthood. High-risk parents struggling with poverty or a baby with disabilities benefit from intensive intervention. Low-income parents may require tangible support, food, money, transportation, affordable child care.
That does conclude the video for Chapter 4 of Child Development 1. Please see your instructor if you have any questions regarding the chapter and video, as well as check in to ensure that you haven't missed any assignments or handouts for Chapter 4.